Come in. Hi, my name is Tessa. I'm going to be your student nurse today. I'm going to go ahead and do a head-to-toe assessment on you, okay?
Okay.
I'm going to go ahead and look at your arm band. What's your name and date of birth?
Taylor Miller, August 17, 2000.
Okay, perfect. Everything matches with your wristband. I'm going to go ahead and wash my hands and put on a pair of gloves. Okay? Do you have any allergies?
No.
Awesome. All right, I'm going to go ahead and start by asking you some questions. Have you had any pain?
No.
Okay, perfect. And I'm going to ask you 4 questions. What's your name?
Taylor.
What's your date of birth?
August 17, 2000.
Okay, where are you?
Centera.
And why are you here?
Checkup.
Perfect. Okay, so my patient is alert and oriented ×4. She's fully conscious. There's no signs of distress, and she looks her age as well. There's no physical deformities, and her stature is tall and slender. She has a good mood, and her hygiene is in good standing as well. So I'm going to go ahead and move on to your upper extremities, okay? I'm going to ask you a few questions before I get started. Have you had any pain? Any changes in sensation, weakness, or limits in range of motion?
No.
Okay, perfect. So I'm going to go ahead and inspect and palpate your upper extremities, okay? All right, so the bone structure and musculature is firm and well defined. Her skin is warm, dry, and intact, and the skin color is in unison with her ethnicity and race. So I'm going to go ahead and grade your brachial pulse, okay? 2+ easily palpated, and your radial pulse, 2+ easily palpated. I'm going to go ahead and check your capillary refill, okay? Can I just see your fingers? Good. So color returns within 3 seconds. All right. Next, we're going to do a few range of motion exercises, okay? Can you just go ahead and squeeze my fingers and then push against my hands? Push forward. There you go. And then pull against. Very good. All right, so she has no limits in range of motion over upper extremities. Next, I'm going to go ahead and move to your head and neck, okay? Have you had any headache? Any pain? Okay, have you had any drainage from your ears, nose, or throat?
No.
Okay, perfect. Have you had any nasal occlusions?
No.
Perfect. Okay, so I'm going to go ahead and inspect your head. So her neck and head are erect, and her face is symmetrical, and it's oval in shape. All of her external facial structures are here. She has her eyebrows, eyelashes, ears, nose, and lips. Her sclera is white, and her pupil color is pink. I mean, not pupil. Her eye color is blue. I'm sorry. I'm going to go ahead and look in your eyes, okay? I'm going to use a light. Can you just focus on my nose? Perfect. One more time. Good. And I'm going to look at your conjunctiva, okay? Good. All right, so the mucosa is pink in her eyes, and her eyes, her eyes constrict to light as well. And I'm going to say that I'm going to grade her pupils as a 5 in diameter. I'm going to do another exercise with you for your eyes, okay? Can you just follow this object with your eyes for me? Good. So her eyes have good accommodation as well. All right. I'm going to go ahead and look in your nose. Can you just tilt your head back for me? Okay, so she has no nasal occlusions, and her septum is midline. And I'm going to go ahead and look inside your mouth as well. Okay, perfect. Her tonsils, I'm going to grade them out of 1. And her oral mucosa is pink. Her teeth are white, and her gums are pink as well. Her mouth is moist. I'm going to go ahead and look at your ears, okay? Good. All right. There is no drainage coming from the ears. There's no lesions. She does have some piercings, but she said that was normal. I'm going to go ahead and grade your carotid pulse, okay? Good. All right, her carotid pulse is 2+, easily palpated symmetrically on both sides. Okay, I'm going to go ahead and palpate your lymph nodes next, okay? Okay. So her lymph nodes are not palpable. And next I'm going to go ahead and move down to your lower extremities, okay? All right. So have you had any pain in your lower extremities? Any changes in sensation? Any weakness or limits in range of motion?
No.
Perfect. Gonna go ahead and inspect and palpate your legs, okay? All right, so bone structure and musculature are firm and well defined. There's no edema in the knees, ankles, or in the lower extremities. I'm gonna go ahead and check your post-tibial pulse, okay? Posterior tibial pulse. Good. 2+, easily palpable. And I'm going to check your pedal pulse as well. Good. 2+, easily palpable. I'm going to check for capillary refill on your toes, okay? And color returns within 3 seconds. I did notice that her skin integrity is warm, dry, and intact on her legs. Her hair distribution is symmetrical on both sides. There's no abnormal venous patterns either. Next, we're going to go ahead and do some range of motion exercises, okay? I want you to go ahead and push down on my hands like you're pushing a gas pedal and pull up towards the sky. Good. So she has no limits in range of motion of her lower extremities. All right. Next, I'm going to go ahead and do a thoracic assessment on you, okay? So I'm just going to go ahead and inspect the chest and abdomen. The bone structure and musculature is symmetrical on both sides of the chest. I'm going to go ahead and check for skin turgor in 2 places. Okay, there's no tenting. I'm going to go ahead and listen to your heart at Erb's point at the 3rd intercostal space. And I'm going to listen here for a minute to get your heart rate, okay? All right, so I got about 74 for her pulse. I'm going to go ahead and listen to your bronchovesicular sounds anteriorly, okay? I'm going to listen in 4 places. I just want you to breathe in and out when I place the stethoscope, okay? Good. And then I'm going to listen to your vesicular sounds, okay? Good. All right, so on the anterior side, there's no adventitious sounds. Okay. Can you go ahead and turn around for me? I'm going to listen to your posterior sounds as well. All right, so I'm going to listen to your bronchovesicular sounds. Just breathe in and out for me. Good. There's no adventitious sounds. All right, so you can go ahead and relax. All right. Next, I'm going to go ahead and assess your abdomen. Have you had any difficulty urinating? Okay, any trouble with the bowel movements?
No.
Okay. Have you had any abnormal drainage from your vagina?
No.
Good. Alrighty. So, first I'm going to go ahead and assess the abdomen. So, her abdomen is flat. There's no abnormal movement going on. And she does have a piercing on her umbilicus, but she said that's normal. I'm going to go ahead and listen to your bowel sounds in 4 quadrants, okay? Good. Oh, excuse me. So bowel sounds are present in all 4 quadrants. I'm going to go ahead and palpate your abdomen, okay? Just tell me if you have any pain or tenderness. All right, did that feel okay? Mm-hmm. All right. So I'm not feeling any lumps or tumors in her abdomen. It's soft as well. I am going to go ahead and wrap up my assessment. So I'm going to just go ahead and state my findings. So as far as the skin integrity goes, her skin was warm, dry, and intact. The color was uniform to her ethnicity and race. The musculature was well defined and firm throughout the entire body. And her neuro assessment was normal. She was alert and oriented ×4, and she was fully conscious and aware of what was going on. She was able to answer my questions as well. I think that concludes my assessment, and I will stop here.